Hi everyone. Today we are talking about GeneSure and to know what is the GeneSure and to understand the benefit of using the GeneSure. First of all, I would like to introduce myself first. I'm Dr. Sasa Vimonpichapankun, or you can call me Dr. Jan. I'm a medical director here at the Genea, Thailand. So what we are talking about today, first of all, we are going to talk about what should we consider GeneSure? Why should we consider GeneSure? And second, what can I expect? What the patients can expect during the treatment? And how do we use GeneSure to select the best embryo? What are the results from using the technology and what next? Here we go. What is infertility? Infertility was the ability of the couple to conceive a pregnancy after a year's or unprotected intercourse, or the inability to carry the pregnancy to terms. But if considering the age, I think when you are at the age of 35 or older and you have been trying for more than 6 months and you cannot get pregnant, then you are also in the group of infertility. Why the age have the impact on the natural conceptions? You can see this graph here. On this side is represent the percentage of the chance for natural conception each month, and on this side is the age in years. You can see that when you are getting older, when you're older like from 35 years of age, the chance of getting natural conception each month dropping very fast. And what has happened when you're getting older? When you're getting older, you will decrease in egg quality, the eggs numbers, and you also have increased risk of aneuploid and also the miscarriage risk. Not only the age that have impact on the fertility, there's many fertility factors that may affect the chance to conceive. This slide, you can see that if we see this dot as the factor, and when you not have any factors at all, let's say if you are at 20 years of age and without any factor, you may get pregnant within 3 months or probably around 20% each cycle. But when you have just only one minor fertility factor, then the chance of getting pregnant should drop down and the time to conceive will be longer. In this graph, show you that when you have just one minor fertility factor, then the time to conceive will be almost 2 years. And this means that the chance is 4 to 5% each month. What happens if you have 2 or 3 factors that affect the fertility? So it means you have a longer times and lower chance of getting pregnancy each month. Here we go. What is the GeneSure? This is the main topic here that we're talking about. The GeneSure is our pre-implantation genetic screening technology. This technique using the next generation sequencing method to look at DNA, which is the most advanced method available and offer more precise information than previous method. It allows us to look at all 24 chromosome type in each embryo to ensure that we are transferring embryo with the correct number of chromosomes. We know that not all the embryos have the correct numbers of chromosomes. Embryos that don't have the right numbers of chromosomes will most of the time fail to implant. Or sometimes they may implant and result in miscarriage. As we know that just a small number of chromosome error can result in the birth of a child with some genetic condition, such as Down syndrome. We can perform genetic testing to screen out these embryos that we know don't have the right genetic before we transfer them back to the patients. As in this graph show you, you can see that in normal IVF, we select which embryos to transfer back into the patients just by external appearance. You can see the first row here, the IVF selection based on embryo appearance. But GeneSure, they help you select the embryo based on the genetic testing. So in this example, the patients might have 5 embryos that look good from what we can tell visually. But however, if we were to do the picture testing, we might find that 2 of these embryos actually don't have the correct numbers of the chromosome, and we should not use them. So this is to save time to conceive to the patients, and we not have to waste the time transferring abnormal chromosome embryos. Now, as I said, the GeneSure will be an option for you when you are getting older because you have a higher risk of abnormal numbers of the chromosome, especially when you are 35 or 38 years and older. If you experience recurrent miscarriage, that means you have to miscarry from 2 or more times. If you had a numbers of failed IVF cycle, or you have history of chromosomal disorder, or you want to increase your chance of IVF success, then GeneSure should be an option for you. From here, I will talk about the IVF process shortly, briefly. From step 1 to step 5. From step 1 is the part of the stimulations, ovary, eggs and sperm collection, go through the fertilization, transfer, and the luteal support. Let's start with the first step of ovulation stimulations here. You can see this is a picture of the ovarian stimulations. This one is pictures of the natural cycle. You can see just only one bleeding follicle here. But if you look another picture here, you can see multiple bleeding follicle. This is how it looks like when you go through the stimulated cycle for the IVF. Step 2 is the egg pickup. The egg pickup is the main medical procedure. You can see that this is very short procedure and it's a day surgery. And we use the ultrasound guidance here to insert the needle, and the needle will be pick up the eggs from each follicle at the time of the egg pickup. Usually will take about 15 to 20 minutes of this procedure. While you have the egg collection with your male partner, we have the sperm collection, which at all our clinic have a very discreet and comfortable room for them. Here is another important part in the IVF step is the fertilizing and nurturing the embryos. On the day of egg collections, our scientists will find the eggs, and then they will talk to the patients about how the eggs grow, how many eggs you have, and what we are going to do with the eggs. The things that we are going to do with the eggs, for sure that we're going to do the inseminations in the IVF cycle. You can see that this is the simple IVF in vitro fertilizations, which is just mix the egg and sperm together, and the sperm will find a way to get inside the eggs by itself. After one sperm get inside, then the egg shell will be hardened, and then the other sperm cannot get inside, so we need just only one sperm here. Yes, and then we move to what does the ICSI look like? ICSI is the intracytoplasmic sperm injections, which we will start with sperm immobilized. Here is a video show you that we use a small needle to do the sperm immobilized. And then we will use the injection pipette to inject the sperm into the egg. You can see how to do that here. Nicely inject the sperm to the egg, just like that. So the day after the egg collections is the day one. It's the next time that you hear from us, as sometimes the nurse or the doctor will call you to update on the fertilizations of your eggs, and then we will leave the embryo to grow and divide into the day three. And this point we take them out again to check development, and we will give you a call from our labs with an update. And from here is the day five of the blastocyst stage. Most of the time, if the patient have the fresh cycle transfer, you will come back and see us on this day anyway. And then we will look into that how the embryo is look like. Is it suitable to do any biopsy or anything? So we will talk to you on that day. So at the end of everything, we will call you again and let you know the overall outcomes of the embryo development. Here we go. This is our time lapse that called Geri. As we know that in the mid-2000s, we contributed the development of MINS or mini embryos incubator that revolutionized the embryo culture around the world. But now we have improved the system even more by adding time lapse here, video recording. Now we can watch everything the embryos are doing at all times on the screen without even needing to disturb the embryos by taking them out. This 24/7 video footage also gives us more information about the embryos than ever before, helping us to select which one will give you the best chance of success. There are other time-lapse systems available, but often capture video comes at the compromise of the suboptimal embryo culture conditions. But Geri is the first incubator that provides video footage at the same time as the goals and at optimal cultural conditions. Your embryo get their very own private chamber. Here you can see they have get own private chamber, so they adjust at very little as possible while they're growing. I'll show you video footage one more time. See, you can observe the embryo growing 24/7. Apart from the Geri, another great benefit of the Geri is that this is the first time that we can offer our patients the chance to see the footage of their embryos as they grow in the lab. Grow is the applications that we develop for smartphone, tablet, which allow patients to log in and see photo and video of their embryos at key time point, which you can also share with friends and family through the applications. This service is available to all our patients at no extra cost. We have just launched these applications in beta versions and received a lot of positive feedback. Patients feel more connected to the embryos, while sometimes you feel a little bit disconnected when the embryo is in the lab. But when you got a Grow application, now you feel that you have something to do with your embryos. And also your partner, your husband also take part in this together. Grow applications also do not replace the in-person conversations with your embryologist. You will still get personal phone call to discuss your embryo development. But now, not only the call, but you can see what we are describing through the Grow applications. Here we go. How we do in the PGS testing. This is we taking a small biopsy of cell from each suitable embryo. As I said, that not all embryo is suitable for testing, but this one is a nice looking embryo and look suitable for the biopsy. And you can see that we just do a small biopsy on cell here without any damaging to the fetal cell inside, or what we call the ICM. Okay, while the biopsy being processed, the embryo will be freeze. So I would like to talk about our first semi-automated verification instrument. This is as what we do all the time. Genea are constantly seeking to improve the innovation technique in IVF. So, the Gavi is the one of the example of our newest development. Gavi is the first semi-automated verification instrument. As we know that there are different methods of embryo freezing used in different clinics, but verifications is the most advanced from embryo freezing available. So we taken this one step further and developed the world first instrument that semi-automated the verification process. This is provide the most consistent and standardized treatment of the embryos during freezing. Here we go. This is the interpreting result of the embryos from the GeneSure. You can see that this one is an example of the normal numbers of chromosomes. You can see a nice signal here, but this one is, you can see this gaining of the signal and is beautiful as increased number of the chromosome. And again, when you see the lost signal here, is mean that the decreasing numbers of the chromosome. Again, the GeneSure is helping us select best embryo to put back, not only by the appearance, but also by the information from the PGS. So then after we got the good embryos, then we go through the embryo transfer. This transferring in embryos usually is kind of straightforward and painless. And we just use the 5 plastic catheter here, loading the embryo inside and put through the cervix into the uterus, which is usually take about just 15 to 20 minutes. And the last one will be the step of the luteal phase and pregnancy test. The luteal phase will consist of all the hormones to support your uterus after the embryo transfer. Probably sometimes we give like HCG or the progesterone. And the pregnancy test will be done 16 days counting from the day of you have egg collections in the first cycle, or 11 days count from the frozen embryo transfer day. During this waiting time of around 2 weeks, Genea also offer the support. You can log into the website, check the blog, and talk to our nurse and doctor in any topic that you want. Here's another slide. Here is about the success rate. As I mentioned before, the GeneSure would help reduce the miscarry and also increase the chance of the live birth rate. And how it's increased, you can see from the graph that both of the age group, this is the group of the age under 38, and this is a graph show the group of the age from 38 or older. You can see that GeneSure, which is in the deep blue color, they both decrease the miscarriage rate in both groups and also increase the live birth rate in both groups. You can see from the slide here. Okay, the things that to consider, the thing that you need to know about the GeneSure, that they are not 100%. It's 95% accuracy, which is a lot. And as we know that, and I also mentioned that not all embryo that's suitable for the biopsy. And sometimes we cannot obtain any result from the biopsy sometimes. And maybe no chromosome. Normally, there is sometimes you not have any normal chromosome embryo left. And this is not guaranteeing the pregnancy, but this is eliminate the risk of the miscarriage for sure. It's not eliminate, that this is not guarantee the pregnancy and also not eliminate the risk of the miscarriage, but it help increase the live birth rate and also reduce the miscarriage risk. So for the last, the GeneSure SSA is the technology that help decrease miscarriage rate more than like almost 50% and helping double the live birth rate. It is helping assess all 23 pairs of chromosome, and this is done in our clinic with the latest screening technology. So for the last slide here, so when that you need to seek for help, when that you need for more option for you to get pregnant. First of all, you feel that something is not right, or sometimes you are under 35 but you're not pregnant within 12 months, or you are older, like 35 or more. You try for 6 months and it not happen. If you have the recurrent miscarriage in the past, if you've been diagnosed with some a factor that may affect your fertility, for example, endometriosis or the polycystic ovarian syndrome, or sometimes that you have the history of genetic family conditions. And the last one, that in case that you not find anything, you cannot find any diagnosis, and you do all the tests and everything look normal, but you're still not pregnant, then sometimes you need to seek for more options and help. I hope that this talk would give you more information about our technology, GeneSure, if you walk through the IVF process, introduce you to see what is the Geri and Geri's look like and what we can do for you to helping you success in what you want, that you get pregnant as you want. So thank you for today. Thank you for your attention. Bye.